Welcome to Drug Use, Physical and Psychological Effects, the online section. Next, let's turn our attention to counseling for substance use disorders and chemical dependency. It's important to understand how the field evolved, the professions who were involved in working with substance abuse clients, and their terminology they use, and their beliefs about what causes addiction, substance use disorders, and therefore how we would go about curing it. Originally, there were pretty well two schools of thought when it came to substance use disorder. One was that it was a result of a spiritual problem and the treatment should be faith-based. It was treated with prayer and required a conversion experience. There are still a number of programs in this area, Salvation Army, the Rescue Mission, and a number of other faith-based programs. Another view, traditionally, was legal. People who drink too much are bad people. People who do drugs are criminals. And what we need to do is arrest them all and lock them up, and that will put an end to the problem. It's a side note, here in California, over a 20-year period, the number of people in prison increased by 1,100%. All of that behind drug use during our war on drugs and get tough on drugs policy. Presumably, with that increase, California is now the safest state in the country, and there should be no longer any drugs on the street. Every day I see another story about an arrest for drugs. Clearly, arresting our way out of addiction has not proved successful. The next development in the history of treating substance use disorders was the medical model. Psychiatry tends to think of and defines in the DSM-5 as addiction as a disease. Originally, psychiatry's way of dealing with things was to try to treat mental health issues with medication. Talk therapy came from two doctors, Freud and Jung and Brewer, of course, and there were others, who discovered that by talking with people, they could induce a thinking change, which might change behavior. Also, related to the medical model is psychology. Psychology tends to study the way a normal brain works. I've seen many people become psychology majors only to be disappointed that they didn't learn how to solve life's problems. But a lot of psychology involves working with rats and mice and mazes and testing and learning and how we learn things, rather than treating something such as addiction or substance use disorder. I described this distinction between psychology and therapy as, at some point, the two of them got a divorce. Psychology more and more has been about the way a brain works, what is normal, and how we learn. Counseling and therapy is about how we solve problems of thinking, feeling, and behavior, and certainly a substance use disorder qualifies as a problem in all three of those areas. There are a number of different professions who work in the area of talk therapies. One of those is social workers. This includes both licensed clinical social workers or associate clinical social workers. This group came out of with their roots in the idea of being friendly visitors who used to go about and work with people who were recent immigrants who might need to learn to speak English, need to learn how to sign their children up for school, and so on. Marriage and family therapists are a new development. And in California, they were the second profession licensed after social workers. In other states, they may have been much later. They include MFT trainees, what used to be called MFT trainees, which is now called associate marriage and family therapists. Trainees are still in school technically, and associates have graduated but are working towards licensure. Then we have licensed marriage and family therapists. In California, the demand for mental health counseling was so great that the majority of marriage and family therapists work with individual clients and may work with serious mental illnesses. In some other states, the number of marriage and family therapists is much smaller, and they primarily work on marriage and family and child counseling. Clinical counselors is the newest profession here in California. In other states, this might be called mental health or counselors. Uh, and as a profession, we have trainees who are still in school, associate professional clinical counselors who have graduated but are working towards licensure, and licensed professional clinical counselors. While marriage and family therapists usually work primarily from a systems theory, the idea that the behavior of one person affects other people, clinical counselors, as I see it, work more with the person in context. They're required to take more training in career counseling and in substance abuse than the average marriage and family therapist. Lastly, we have the profession called substance abuse counselors. For a long time, substance abuse counselors developed with a different roots and different background and have a different way of looking at the problems. For a good part of our history, if someone went before a judge and said they were an alcoholic, they were likely to be sentenced to a sanitarium, which is the forerunner of the modern mental hospital. Doctors didn't like to treat alcoholics because they almost never recovered. If you said you were a drug addict, the judge was likely to send you to prison as a habitual criminal. Beginning in the late 1930s, about 1935 to 38, Alcoholics Anonymous and other self-help groups began to emerge. Alcoholics Anonymous was the first, but out of that, other recovery programs have grown out of the 12-step model. In this system, counselors are largely peers, and it was a long time before it moved from being a self-help model to being a professional paid treatment. But still, in the early days, up until very recently, most drug and alcohol counselors were themselves recovering people. Recently, substance abuse counseling has become more professional. We've developed here in California a system of registration and then later on certification. Some other states have licensure with varying requirements. There's also been a movement towards advanced degrees, moving into the area of working with substance abuse or substance use disorder clients. One of the professions that has moved into this a lot recently has been the clinical counselors because of their additional training in substance use disorders. Another movement that has been gaining force is the idea of treating co-occurring disorders. The majority of substance users have a mental health problem, and a very large majority of mentally ill people have a substance use disorder. So we expect the overlap between those two problems to be quite significant. More and more substance abuse treatment facilities are hiring people with master's degrees or licenses to be able to coordinate the co-occurring disorder clients' treatment. It's very important to pay attention to the difference in terminology that the various professions may use. Medical doctors and psychiatrists, and I've had them call me and ask me, is this person chemically dependent? By this, they're largely talking about physical dependency that might cause withdrawals. Psychologists are more likely to stick to criteria, and they may separate people into physically dependent or just psychologically dependent. Therapists, mental health counselors, may also be looking at the DSM diagnoses. If you look at older charts, you'll see when we use the system of defining it as abuse or dependence and intoxication and withdrawals, all four of which had a list of symptoms. We now have in the revised system intoxication, withdrawal, and substance use disorders, which occur on a continuum of mild, moderate, and severe. Substance abuse counselors, many of whom are peers or have been traditionally, are used to thinking in terms of, is this person an addict, or an alcoholic. And if the person says they are either of those, then the self-help program has a solution for that. Faith-based people are likely to talk in terms of congregation or beneficiaries, and often ask for a testimony about the person's faith and conversion experience. Law enforcement would think in terms of criminals. Have they been arrested? What are their convictions, and so on. Peers, who usually work in the mental health system rather than substance abuse, may refer to people they work with as either consumers, or many programs now use the term clients. There's also huge differences in self-disclosure between the various professions. Medical doctors, psychiatrists, and psychologists frequently do not self-disclose. If you think about Freud sitting behind the couch so that the client he was working with couldn't even see his face and whether he was smiling or frowning. Therapists, mental health counselors, often have very limited self-disclosure. I think that clinical counselors are taught more to use appropriate self-disclosure, whereas MFTs often are taught not to self-disclose or to limit it very strictly. Substance abuse counselors, on the other hand, are very likely to self-disclose because many of them are in recovery. Many of them attend 12-step meetings and are used to introducing themselves as either an addict or an alcoholic. In peer programs, where many people are in mental health recovery, someone might introduce themselves as having schizophrenia or having major depressive disorder and share their story of how their disorder impaired their life and how their treatment has helped them. Faith-based programs frequently limit their sharing or self-disclosure to testifying about their faith and conversion. I see people who attend a faith-based self-help group who are often reluctant to share about their drug or alcohol problems. While they may be able to testify about other things, they may find that they're discriminated against by people who don't understand that substance abuse may well not be a voluntary thing, but may be a disease. And law enforcement often thinks about the person in terms of what were they charged with and what were they convicted of. In my in-class programs, teaching, I would at this point say the reason I went through those professions and their self-disclosure is that I suspect that there are people in this class for a number of reasons. And I don't want people to self-disclose more than they are comfortable with. But I would ask them to think about, why have you found yourself in a substance use disorder counseling program, or at least my class in that program? Many of the people who come to that class plan to be substance abuse counselors. Some of them plan to work in the mental health field. Others may be social workers in training or nursing, or plan to work in the medical field in some aspect. Often I find students in my classes are there because they have friends or family who have substance use issues and they want to be able to understand it. Sometimes people take the class because they are in personal recovery. And even if they do not go on to work as a drug and alcohol counselor, taking classes like this can be very beneficial for people's own recovery. And then there's always a smattering in a large class of people who are there for other reasons. Criminal justice majors, or people who just thought it would be a good elective to know something about drugs. People who might want to be paramedics or nurses or so on. So if you're listening to this, I would invite you to think about why you might have watch this video if you're registered in one of my classes, or if it was simply something you're interested in.